The talk I gave this morning was looking at a new ultra-sensitive circulating tumor DNA detection assay in the TRACERx study of lung cancer. So TRACERx is a prospective observational clinical trial where patients with early stage lung cancer have undergone surgical resection with curative intent, and they've had blood sampled pre-operatively and then also during the disease course. And what we were looking at was the impact of an ultra-sensitive assay for stratifying patients into different groups based on clinical outcome. Now, we've looked at this before using less sensitive assays, where typically the limit of detection is around 80 parts per million of ctDNA. And what we'd shown there previously was that ctDNA negative tumours at baseline tend to do much better. But an important question that remained was, to what extent could this be improved using a more sensitive approach? So we teamed up with Personalis, who are a US-based company who have NeXT Personal, which is their whole genome sequencing, second-generation tumor-informed ctDNA assay. They track 1,800 mutations, and their LOD is around 1 to 3 parts per million. And what we showed was that if you stratify patients by whether NeXT Personal identifies ctDNA in the blood pre-operatively, those that are ctDNA negative at that time point have an extraordinarily good prognosis. So the 5-year overall survival of lung adenocarcinomas without ctDNA detected was 100%. Now, an important result was what happened when we focused on tumours that had ctDNA detected at below the limit of detection of the previous most sensitive approach looked at in TRACERx. So this is 80 parts per million of ctDNA. And what we showed was that tumours where ctDNA was detected at below 80 ppm by NeXT Personal, this assay, had a much better prognosis than ctDNA negative tumours as defined by NeXT Personal. So this really opens up interesting avenues in terms of disease stratification, pathological staging, implementing ctDNA in that.